we have been in the hearing business for quite a few years. And I don't know about you, I still get so many questions in this space all the time. So let's cover a couple of things, like some of the changes that have happened in hearing. The big news was the OTC business, right? Coming around. Now there's converging technologies out there like hearing algorithms, getting into your AirPods and those kind of things. Just give me your brief take on that. What do you think of some of those changes in our marketplace?
Well, the first one, over-the-counter products, I think what the intended outcomes were good. It was to help people have access to affordable hearing, products. But I think that either there was a misunderstanding or possibly even denial of what the patient needs beyond the product, and that the product itself and that delivery model may not satisfy the patient's demand. So, I think that they're working through that. And, my personal experience with family and friends who wear hearing aids, and we're talking about, people that are competent, ambulatory, have some technology, skill sets. That model does not work for them. I know because they're accessing our facilities, they're getting help, they're seeing providers. And if they didn't need to, they wouldn't. They're doing it because they need to. So there's obviously a place for that product, but I don't think it's going to displace a lot of the traditional setting of patients needing to see providers for care, post-fitting care, purchase decision-making, things like that. So,
yeah, I see a lot of the same conversation around the AirPods too, right? It's like when people actually experience real hearing loss and they need a really precise high-tech product that's going to actually fit the gains that they're going to need in their hearing loss. And remember, hearing loss isn't a one and done thing. It's sort of a journey, right?
mm-hmm.
And we know that a lot of times when you get your hearing provider and your professional over time, you need to adjust it over time. And so I know a lot of those businesses are actually, right, looking for face-to-face providers to actually give some help for some of their OTC products, right?
Right. Well, I think it's altruistic to want to bring down the cost of care, right? So from a product standpoint, that's what OTC is. I think now the industry needs to evolve, and part of that is just growing, more patients getting help, more retail dollars coming into the market, and then really figuring out as an industry how you can deliver care at maybe different levels of needs at lower cost. So, the patient who has lower needs, and I think this is where OTC, intended to go, but they didn't build in the factor that these patients may still need to go seek help. And that help obviously is going to have a cost with it also. So what you don't want to see is the products hit the market, those patients not be happy with their experience, and then they don't seek solutions to what that is. It doesn't mean new hearing aids. It could be counseling or whatever, but now there's more cost, right? And as you add that cost, you start going, well, maybe they should have gone and just built a relationship with the provider from the beginning, right? Mm-hmm. So that's, our vision at PHN is how do we continue to evolve our model to deliver care at lower cost, but maybe that cost goes up as the needs get greater with the patient, which means labor costs, product costs, the whole 9 yards.
Yeah, good. So on the topic of change, the other side of the business that we have seen grow quite a bit is the insurance side and third-party side of the business that actually services those Medicare Advantage patients and members that we see. Do you see that continuing to grow over time and perhaps even more members getting coverage?
Well, I do, just based on where it is today with the growing number of population turning 65, going on Medicare. Even if the percentages stay the same, there's approximately 60 million people on Medicare. 30 million of them have Medicare Advantage plans, of which most, if not all, now have hearing benefits. So even if that stays 50-50, if the number goes to 70 or 80, then it'll be 35 or 40 million that are on Medicare Advantage plans. What's interesting for me to view or see happen over time is we were paneled with insurance companies long before the HBMs and the TPAs, the Medicare Advantage plans. And then as they came into the fold in 2005, 2010, we were aggressive about participating with them because we were already insured. So we saw our patients' benefits transferring over. So I've been working with them for so long that I just consider them a part of our business. And I think that if it lowers the cost for a patient to get help, that's positive. In our business model, working within the PCP space, it is very important that we participate because the patient's physicians, our network members, the doctors, they want to know that their patients can access benefits if they have them. That's important to them.
Yeah, that's really important, right? And you tell them if in fact they have a benefit, wouldn't they? That's important as well. And I'm sure it's important in the PCP setting.
Oh yeah. We verify every patient, obviously, it's protocol.
Yeah. Talk a little bit about the Achieve study and some of the National Council on Aging work. We used to think of when you losing your hearing over time, it used to be an inconvenience and a problem, but now it's really moving into a detriment to your health. With some of this work that now is linking untreated hearing loss with things like cognitive decline, depression, anxiety, even hypertension, all that is getting some greater awareness now. Do you think that is leading to some of your success with PCPs?
I do. I think that current science and its findings that are related to hearing loss and the media attention that it's getting is, let's not say first it's good for the industry. Let's say first it's good for the public, to be aware of these things. And then they need to be proactive and go get checked. And so I think that from that standpoint, in the journals that physicians, rely on to keep up with medicine and advancement, there's enough being written now to where they're certainly aware. They have a top of mind awareness. They have relatives who have hearing loss. They're being impacted by it. They themselves may have hearing loss. We've certainly, have fit hearing aids on some of our primary care physician members. So when we looked at this opportunity, and I can't remember who wrote about it, but I remember reading a way to identify a business opportunity, and the acronym was BUT, and it was, is it big enough, unique enough, and is the timing right? And I felt like what we were doing at Physicians Hearing Network met those three criteria. And this is just enabling and accelerating the timing. What we're doing today, probably the timing would not have been right 25 years ago.
Sure.
The timing's right today. And we'll probably talk a little bit more about some of the things and learnings, that we've experienced so far that are related to that.
Yeah. Speaking of timing too, and what's in the cultural conversation right now, this whole aging well, longevity tech, age tech, health span versus lifespan. We're seeing a lot of those topics today in the marketplace. Do you see that providing momentum as well? I think just people are caring more about living better.
Yeah, I saw or heard a news report about aging. And one of the things that they talked about is we're not extending age itself necessarily as rapidly as we had. That, you know, I guess biology or the body itself has, science has caught up to its capacity, if you will, to extend us. So, if we live, very small numbers, if there's people living to 110, we're not talking about extending to 150. What we're really talking about now is more people living till they're 80. And how are they going to live those, or 85? How are they going to live those last 15 years? What is the quality of life going to be? And when you relate that to hearing, those who work in the profession, they have already been providing technology solutions to extending a healthier lifestyle for patients. So when you look at, and again, I have this experience in my own circle of friends and family, people who had chose not to wear hearing aids, or people who don't wear their hearing aids properly, don't wear them all the time. You can see there, at least from a emotional standpoint, decline. They withdraw, etc. And those are all parts of living a healthy lifestyle. So, I think that the hearing industry or profession has been associated with better aging, longevity, lifestyle than those catching up today. So, we can be proud of the work we've done and continue to build on that.
I think we've been part of longevity tech for a long time,
Yeah,
actually, if you think about it, right?
absolutely.
Yeah. So back to PHN and your start. I'm always interested in the lessons that you learn and any of the pivots that you learn in a new business along the way. I think they're fascinating. Talk about some of those lessons in your early stages at PHN.
Well, lots of lessons, lots of learnings, lots of pivots along the way. We entered into a new space, so there was no playbook to go out and learn from, to steal, if you will, how others have already done it. So we're writing the playbook, if you will. I would say the first thing we had to do was to identify and understand what the challenges were to actually integrating hearing healthcare services into a primary care office. And people have done it at a local level for years. As I said, I worked, had a couple offices that were in primary care. But, we're talking hundreds of locations, if not, thousands of locations eventually that'll be inside primary care physicians' offices. So really understanding what the challenges were up to this point, or at this point, what those challenges are. We had to learn what they were and then begin developing solutions to how to overcome those challenges. And the biggest learning related to that would be understanding a typical primary care physician's office's workflow. How do they process patients? And then how do we take our best practices of workflow and how do we assimilate that into theirs, because they are less likely to adjust to ours, right? So, instead of doing that, we had to figure out how to do that. So we had to be the ones willing to adapt our best practices to what fits into theirs. And then once we were able to do that, then as we grew in locations, the variables started reducing, they started decreasing, and our predictability got better, in terms of expected outcomes. So that's been good. I'm sure Barb, that the bigger the problem, the bigger the opportunity. So from that standpoint,
Bring it on.
Bring it on. It's been great.
Bring it on, right?
Yep.
That is the real secret sauce there, right? If you're able to crack the code on that. And I think you actually pointed out something really important. There's been many hearing industry people who have actually tried to bring hearing into like a convenience store or, a drugstore or those kinds of things. And we're always trying to take our model and plop it in somewhere. What you did is something different. You actually worked the way to actually combine it into the PCP workflow.
Our team did a great job of networking to gain a better understanding of what that was, how we would do that. And, in the beginning of the company, we've gone through a number of iterations and, there'll be a few more, but there was successes in each of those iterations. But how scalable, how big, how fast could you go in that iteration? So, for us, with the plans we have, as ambitious as they are, we weren't going to be satisfied with those iterations. We had to continue to push ourselves to learn more on how we could do it better to be bigger, faster. And, I think that we're at that point now where probably the biggest learnings that we had to encounter and solve were there. Now it'll be more of a maturing process, getting better, refining what you're doing. But, from a sales standpoint, operation standpoint, marketing standpoint, we had to work through those learnings in each of those areas and get better and better and better. And they're all at, a really good level. And, working for a startup is not easy. So for those who, have been, part of our journey, a lot of people aren't with us. We started, right before COVID hit. We lost a lot of great team members. Everybody has had a part in PHN's growth. And, many of them aren't here today, and some of us will still be here, when we get to really celebrate in a big way. But all of them, will be celebrating the success because patients having access to hearing healthcare at a primary physician's office, it may not be everybody's option. And, that's great. But to have that option is important. And I think we'll all be proud of bringing that to the marketplace.
Yeah. You talk about this as a blue ocean opportunity versus red ocean sometimes when you talk about PHN. Can you elaborate on that a little bit?
Sure. Today, the patient's journey is 6-7 years. It's convoluted at best. It could be the neighbor telling you they go here. And for, those 2 hearing losses could be simple. And where that one person goes, they have, the level of care that meets their needs fine. This other patient might have more complexity to their hearing loss and greater needs, and maybe that's not the right place for them. Some people go straight to the ENT, and we work in the ENT space, and there's certainly lots of patients that didn't need to be in an ENT office. Obviously, there was no pathology involved with their hearing loss. It was sensory neural, and they may be going into a little bit more expensive channel to get treated in the same way they could have. And that's a cost on insurance. And there's a lot to be discussed about, that channel. Obviously there's people who need to be in that ENT office, but it's not all the patients that end up in there necessarily. So, so we felt like the blue ocean opportunity was to provide almost a simplified pathway to where you go in, you get screened, identify whether or not a patient has a hearing loss, whether they do or don't, at least from a preventative standpoint, start educating that patient at some level of, requirement, based on their needs. Keep up with annual checkups, become a regular routine along with the other wellness visits that they make, include hearing with it. And if the patient does have a hearing loss, that the doctor's aware of it, and could it be associated with other comorbidities, that would be important. And then lastly, when they do have a hearing loss, to be able to provide them the options, to treat that loss. If it needs to be referred out, then make that referral. So it's really more of a 3-step process. It's get screened, educated, and get treated if need be.
Right at the PCP office, because you're getting your annual wellness visit at that office. So it happens right at that point in time, right?
Correct.
Yeah. Now, the hearing industry has been trying to work with PCPs for a long time to try to get referrals. As you said, you did as well early on. So how are you at PHN able to connect the dots with this service model in a better, how did you crack that code?
It wasn't easy. Took a lot of work, a lot of effort and investment to work with enough PCP offices to understand the common denominators amongst them, and then be able to really build a model around that commonality to be able to grow the business. So, after several years of now working with PCPs, we've really developed what we believe is the model to be able to scale. And we're excited about that moving forward, that, we can now accelerate growth with more predictability.
Yeah. So talk about that model a little bit, that you've kind of come to figure out.
Well, I guess when it comes to connecting with PCPs in that context, the first thing was from a sales perspective, was it something that they wanted, as a profession? Did they want that service inside their office? And we learned very quickly that, they do care about patients' hearing. They just are challenged to be able to deliver that service, So we knew if we could develop a solution to that, we could be successful within the primary care space. Second was operationally, we needed to make sure that you could build a model that ensured predictability, it was profitable, and it could scale. And if so, then, it could be built. And then the last thing from a marketing standpoint was, could we increase patient flow? Were there marketing strategies that we could identify that increased patient flow? And then, of course, location growth. How, from a business development standpoint, how can you economically scale the business and remain sustainable and profitable?
So PHN is a turnkey solution that you make available to primary care. It's great that you've been able to work with, because primary care physicians are all different. So to be able to scale something and learn that importance of how to create the standardization, at least in some portions of your offering, is really important in this model, right?
Yeah, we had to overcome the people variable. We had to build a turnkey solution that at least mitigated that component in the relationship.
Yeah, because it's hard to standardize things that are completely customized across the board, but it can be done.
Yeah,
So
we didn't want it to be people dependent. We wanted it to be process dependent.
Perfect. Yeah, that's the way you scale, right?
Yep.
Now, you have developed some nice traction. Talk about your growth plans.
I believe in 2024, we're experiencing what is projected to be about 60% growth year over year. So if we finish Q4 strong, we should be somewhere 60% or so of year over year growth. Then from a location standpoint, we plan on growing to 100 location not 100, 200 locations in the next couple years. So we're super excited about that. Believe we're 51, 52 locations, 76 locations contracted right now. And then we're excited and feel fortunate to have some excellent technology partners align with us on this business. Recently, we added a cognition partner. So that's an additional service offering that we're actually pilot testing it right now. And then we'll continue to reach out to the community as we see opportunity.
60% growth, pipeline of new PCPs, and growing to probably 4 times what you're going to do. That's quite an aggressive growth strategy.
Yeah, the next couple years, location growth would be 4 times.